Welcome everyone, and very good afternoon to all of you. And I'm really thankful to all of the participants who come here to listen to this session and our panel discussion. Okay. So I'm going to talk about the role of nutrition professionals in optimizing the value of healthcare, which is the key component for the healthier communities. So in the next 15-20 minutes, I would like to throw some light on these issues. Like we will have a look at the current healthcare situation in Pakistan, जो कि डॉक्टर ज़की बहुत अच्छे से हमें describe कर चुके हैं कि what is the current situation, and then the nutritional landscape of Pakistan and the impact of nutrition on health. And then I'll be talking about the role of nutrition professionals in education, training, community nutrition initiatives, policy and advocacy. And then we will be discussing some of the challenges and barriers which we came across during our practice. I think most of the participants today here are the nutrition and dietetic professionals who are working in different hospitals and healthcare sector, and then we will be discussing the way forward. So this is the overview of healthcare in Pakistan. Besides primary healthcare, secondary healthcare and tertiary healthcare, we have not been able to decrease the infant mortality rates up till now, which is more than 50%. And the healthcare expenditure is 2.8% of GDP. So if we look at the nutrition situation, you can see, and we are all aware about this fact, that 37% of the Pakistanis household are food insecure, and the prevalence of malnutrition among like mothers and children under 5 years of age. And similarly, on the other hand, we are facing the burden of NCDs in Pakistan, and the cardiovascular diseases, cancers and diabetes are becoming the major causes of death and disability in Pakistan. And similarly, when this malnourished nation, when they become sick, or if they are affected with any kind of disease or chronic disease or acute illness, then we see that hospital malnutrition is a well-established fact, but it is remained under-recognized in the healthcare setting. So these are the slides which are showing, it has already been discussed, the link between nutrition and diseases like diabetes, hypertension is now well established. On other hand, importance of nutrition during pregnancy and early childhood, we cannot ignore these facts. So if it is also known that the dietary risk factors and the behavioral risk factors are among the top on, if you look at the different causes of NCDs in Pakistan. So I think this study has also been discussed by Dr. Khavar, so I'll be just skipping it. So if we talk about the prevalence of malnutrition among hospitalized patients, though we don't have more accurate and large-scale data, but this through different studies which have been conducted in Pakistan in different settings, it has been found that 30 to 60% of the patients who are admitted in the hospital are the malnourished. And this malnutrition often stems from the factors such as the inadequate dietary intake, their underlying health conditions, and the limited access to nutrition resources. And clinical malnutrition can lead to the need for high dependency clinical care, lengthen the recovery times, and increase the likelihood of high risk complications. And it contributes to the worsening of both chronic illness and the acute illness and infections. So who are the nutrition professionals? Basically, registered dietitians and nutritionists are the food and nutrition experts who applies evidence-based science of food and nutrition to promote health, prevent and treat diseases, and to optimize the health of individuals, groups, and communities and population. And all dietitians who Like they have the minimum of graduate degree, and they have completed 1 year of supervised practice requirement, and they have also passed a national exam which meets the international competency standards and continue professional development throughout their career. And this exam is currently conducted by Pakistan Nutrition and Dietetic Society. So, like if you look at the basics, like besides qualification, dietitians must have the scientific and the research-based thinking. They have critical thinking, and they share best of their practices and have the excellent communication skills, in which they use like for the patients to translate the scientific facts and to translate in a simpler language for the patients to their understanding. So according to the international domains of competencies, these are the 5 domains of competencies that should be, a dietitian should have these 5 domains of competence, whoever is practicing in as a nutritionist or dietitian. So, and they have to follow a code of conduct while interacting with the patients. When providing services, the nutrition and dietetic practitioners adheres to the core values of customer and patient focused, integrity, innovation, and social responsibility. Why code of conduct? Because the primary goal is the protection of the individuals, groups, organizations, and the communities or population with whom the practitioner works and interacts. And the professional code of conduct actually provide benefit to the public as they build confidence in the professionals, trustworthiness in client, as they provide greater transparency how their affairs will be handled. Because one should be confident enough that if they are consulting a registered dietitian, they should possess all of these qualities. So expertise of nutrition professionals is essential in optimizing health outcomes and enhancing the quality of life for individuals and the communities. If you look at the role of nutrition professionals in the hospitals, their key responsibilities are the nutrition assessment, nutrition diagnosis, nutrition counseling and education, meal planning and dietary modification. While some dietitians have a specialized area of practice, for example, some specialize in the kidney care, diabetes, digestive disorders, burns, critical care, and other specific conditions like inborn errors of metabolism and different conditions and diseases. And they are also involved in the education and counseling of the patients. And they have to work with the doctors, nurses, and public health officials. So they have to interact and collaborate with other professionals in order to perform their duties. So, like this, I was looking at some researches and counseling. There were some meta-analysis and systematic reviews conducted to find out whether the counseling by the registered dietitian as compared to usual cares improve the following outcomes. Like they have proven roles in the blood pressure reduction, urinary sodium excretion in adults with CKD, in the weight outcomes, blood lipid and blood pressure in adults with dyslipidemias, to achieve the good glycemic control, and as well as dietitian involvement may improve weight and dietary intakes in individuals with the eating disorders with psychological treatment compared to the psychological treatment done alone without with weight management interventions. And dietitians delivered interventions may be cost effective in management of the disease as well. So these are the references, you can look, I can give you the references. So like in chronic kidney disease, a systematic review and meta-analysis was done of the 8 RCTs. Similarly, for dyslipidemia, the review of 3 systematic reviews, including 3 randomized controlled trials in total, and so on, like weight and diabetes and pre-diabetes and type 2 diabetes. Okay, the dietitians also have a role in delivering the safe food to the hospitalized patients and in other healthcare setups where food is being provided. And the nutritional status of the patient is actually dependent upon the chain of interacting links. A failure in any one of these links leads to the failure to the whole chain. If you look what the patient is eating the food, the patient's screening and monitoring, then the menu we are providing at the hospital, then the food preparation, food distribution, food service and ambience. So usually the dietitians who are working in the food services as a food services managers and directors, they work with the multidisciplinary team and have the expertise and educational training in both clinical skills and the food service operations. And that should be free of any hazards, and all steps of providing safe food are being followed. So some dietitians are engaged in the research on nutrition and health and implementation of the evidence-based practice guidelines in clinical care settings. So these are the different roles that dietitians can play, and they can work in different setups. Like other than clinical, there are many opportunities in the public health sector, and similarly in the nutrition education, academia, with the corporate sector, in the pharmaceutical and like pharmaceuticals and food industry as well. In the quality assurance departments, many dietitians are working. So basically I'm showing this slide specifically because most of the time we just limit the role of dietitian. We only thought that dietitian is only meant for the weight loss, that's it. Like if you are referring your patient to dietitian, so many times it is for weight management, that's it. We don't realize that their role can be multidimensional and they can work in the multiple areas with their expertise. So the future competencies of nutrition and dietetic professionals can be the genetics, genetic testing, personalized medicine and precision nutrition, which is already like, it is a developing field. Like many dietitians are working on precision nutrition and personalized medicine, policy, politics and finance as well. Because if dietitians are involved in the policy making, there will be different kinds of nutrition related policies in place if they are involved in. So if we look at the state of nutrition policy in Pakistan, these are some facts that patients are not screened for malnutrition upon admission. Although nutrition and screening involves very basic, there are very basic screening tools, like in which you can just simply ask patient for 3 questions. If the patient has lost 5 to 10% of significant weight loss, if there is a significant weight loss with more than 5 to 10% in any patient, if the dietary intake is compromised for more than 3 days of the patient, and if he's unable to consume like 50%, like less than 50% of his actual intake, or a third question is about, I think 2 questions, and the third one is like very basic 3 questions, and through which you can screen the patient and refer it to the nutritionist or dietitian for further management or further counseling and education. But unfortunately, I worked in a hospital for more than 20 years, but I was unable to convince my management to implement this screening tool in my hospital, although it was a very well-known setup with modern and standardized care. But the less, nutrition is being given very less importance at times, we feel that. So there is a dire need of establishing nutrition policy for healthcare system in Pakistan. Usually we see that therapists, pharmacists, food technologists, medical technologists are hired in place of dietitians and nutritionists in different roles. And the lack of nutritional knowledge among clinical staff is a persistent issue. So, if the patient is early diagnosed and the level of malnutrition is early identified and the intervention is made, you can reduce the complications rate and length of stay of the patient, and even the readmission rates and mortality, and eventually the cost of care will be reduced by these simple initiatives. So these are the challenges which are faced by nutrition professionals. There is no regulatory body available to regulate the practice of dietitians. It means anyone can claim themselves a dietitian or nutritionist without having any specific degree in nutrition or qualification in nutrition. And all over, like we are seeing multiple professionals who have adapted to become a dietitian. Although some of them are biochemists, some of them are food technologists, but they are running their practice and practices on not only even on social media, but in actual, their clinics are running, and everybody is inviting them as a consultant nutritionist and dietitians, even in the programs and even in the conferences. People are not aware that they are qualified in their own field, but not in the nutrition. So, and again, there is a lack of standardization in nutrition and dietetic education programs as well. Because in the past 10-15 years, we are seeing multiple programs offered by different universities in Pakistan. I think in the last 10-15 years, there was a study, small-scale study conducted to review like how many universities are offering nutrition and dietetics programs, and it was found that more than 50 universities in only Punjab. और अगर हम अभी कराची की सिचुएशन देखें तो यहाँ पर भी आपके पास 5, 6, 7 यूनिवर्सिटीज़ अचानक से उन्होंने प्रोग्राम स्टार्ट किया है. और इफ़ यू लुक एट देयर फैकल्टी, you won't even find a single person who is nutritionally qualified in nutrition or dietetics. Like teachers are teaching with diverse backgrounds, sometimes physiotherapists, sometimes food technologists and other physicians, they are teaching them nutrition. So you can imagine the quality of these graduates who will be coming up after completing their degrees. They will have the degrees with the correct title, but they will not have the skills, the right kind of skills which they should possess as a dietitian. So lack of relevant qualified staff, I have mentioned already. Insufficient reimbursement of nutrition services, lack of career ladder in healthcare systems. If a dietitian is working in a hospital for 20 years or 25 years, she will remain on the same position. She will become the head of the nutrition department. That's it. There is no career ladder. No matter if her publications, if she has published more than 5-10 papers, but there is no career ladder, unfortunately. So this is why, and many times, like these positions are, the role of dietitian is actually minimized in many cases. Like instead of highlighting the importance, if like they have 2, 3, 4 members in one department, hospital management want to reduce it to one dietitian per hospital. No matter 100-bedded hospital or 200-bedded or 500 or 1,000. And at times they don't have one dietitian or only part-time because they don't want to pay. They don't want to pay them sufficiently. So there is a limited awareness of nutritionists' role in healthcare, and there is a dire need to integrate nutrition into the existing healthcare system. And the last, I'm just finishing my presentation on this note. Because nowadays it is ये सोशल मीडिया का दौर है. यहाँ पे हम देखते हैं कि बहुत सारे लोग न्यूट्रिशन के बारे में एक अपना ओपिनियन रखते हैं. No matter if they are saying right, nobody will know about it. I mean, as a general layman, you will believe if a qualified person is giving you some thoughts or giving you some logic, which is self-perceived logic or reasoning for that matter, because it is not their area of expertise. So some few examples is the chicken intake cause the PCOS. Pink salt is the miraculous salt, even good for hypertensive patients in any amount. So, and at times we see people, they refer some kinds of food practices to the Tibbi-Nabawi. Although, and sometimes they relate it to the Ayurvedic concepts. Ayurvedic and Tibbi-Nabawi, ये match नहीं करते. मतलब you cannot mix 2-3 concepts together and make something which attracts people most. And in Tib Nabi also, there is no restriction on food combinations and any sort of food ingredients. Here is the example of sodium contents of different salts. Any kind of salt should be restricted. If there is a restriction, तो उसके लिए कोई भी सॉल्ट हो वो इक्वली हार्मफुल होगा. ये नहीं कि पिंक सॉल्ट है तो वो बहुत ही कोई सेफ़ है या बहुत ही अच्छा सॉल्ट है. इसी तरह से चिकन है. ऑल ऑर्गेनिक फूड्स आर सेफर और हेल्दियर देन कन्वेंशनल ऑल्टरनेटिव्स. दिस वाज अ सिस्टमैटिक रिव्यू एंड इट फाउंड दैट there is no consistent difference between organic and conventional produce of, because ज़ाहिर है दुनिया तरक्की कर रही है तो बहुत सारी चीज़ों में डेवलपमेंट आ रही है, मतलब क्रॉप्स के अंदर और डिफरेंट नई टेक्नोलॉजीज़ आ रही हैं, तो वी कैन नॉट सिंपली रिजेक्ट देम. So polycystic ovarian syndrome is not caused by eating chicken. It is the result of physical inactivity, overeating, more intake of refined carbs, and then hormonal imbalances are created, and then you have the PCOS. So there is one of the, this is the last one, this is my last slide. There is a doctor, she was promoting that doodh patti is the cause of obesity, metabolic disorders, cancer, autoimmune disorders, and so on. Like, if a qualified person is propagating such kinds of, ideas, like it is, people tend to believe them. People believe them because, if they have a huge fan following on social media. So we need to, like tannins, tea में क्या होते हैं? Tannins होते हैं. And these are basically antioxidants. ब्रूइंग टी, जितना आप उसको ब्रू करते हैं तो ज़्यादा टैनिन्स एक्सक्रीट मतलब उसमें से निकलते हैं. एंड टिल डेट देयर इज़ नो रिसर्च ऑन दूध पत्ती. इट इज़ अ डेंजरस ड्रिंक. Like some data shows that addition of milk to chai is a source of protein and some calcium, and dietary calcium is already absorbed 30%. But obviously, excessive consumption of anything can be bad. So, we need to, जब तक हम differentiate नहीं करेंगे कि who is the right professional, who is not, who is conveying the right information, तो जो हेल्थ प्रोफेशनल्स हैं उनके अंदर सबसे पहले अवेयरनेस आने की ज़रूरत है. फिर हम पब्लिक पे काम कर सकते हैं मिल के. बिकॉज वंस यू अंडरस्टैंड दैट एवरी प्रोफेशन, अब जो न्यूट्रिशन साइंसेस है वो बहुत डेवलप कर गई है. हमारे मुल्क में इतनी रिसर्चेस नहीं होती हैं फूड पे, लेकिन जो डिफरेंट लाइक डेवलप्ड वर्ल्ड है वहाँ पे बहुत चीज़ें हमें, बहुत से डेटाबेसेस हैं जहाँ से हमें जो एविडेंस है वो मिल जाता है साइंटिफिक के. अगर कोई फूड स्पेसिफिक किसी पर्सपेक्टिव से अगर किसी चीज़ की कितनी लाइक उसकी कितनी वैल्यू है या उसकी रिस्ट्रिक्शन की या उसकी प्रमोशन की. So the way forward is utilizing the expertise of nutrition professionals is essential for enhancing patient outcomes and revitalizing the optimized healthcare. Collaboration among the nutrition professionals, medical professionals, policy makers is vital in creating more effective and comprehensive healthcare system and research. And Nutrition and Dietetic Council is very essential for delivering comprehensive healthcare, and which can recognize the integral role of nutrition in patient health, leading to improved outcomes and enhanced quality of care. And then at the same time, standardization and quality assurance of the curriculum of nutrition and dietetic professionals, and the inclusion of nutrition in medical and allied health teaching programs and training, so that they can realize the importance of nutrition, and they are better able to recognize the right professionals and the importance. Because जब डॉक्टर किसी चीज़ को इम्पोर्टेंस देता है और फिर वो रेफ़र करता है किसी डाइटिशियन के पास, तो पेशेंट का कॉन्फिडेंस एक डबल हो जाता है. मतलब वो ये समझते हैं कि हाँ डॉक्टर साहब ने भेजा है तो अब बस आप ही बताएंगी कि आपने क्या खाना है. लेकिन अगर डॉक्टर साहब ये कह दें कि नहीं डाइटिशियन का तो उसमें कोई काम नहीं है और जो मैं बता रहा हूँ वो सही है, ऐसा भी होता है प्रैक्टिस में. ऐसा ही होता है कि डॉक्टर साहब जो हैं वो कहते हैं कि जी डाइटिशियन की बात आपने नहीं सुननी है, आपने मेरी बात सुनी. तो ये कॉन्फ्लिक्ट नहीं होना चाहिए. ऑल हेल्थ केयर प्रोवाइडर्स शुड बी ऑन वन पेज. दे शुड कोलैबोरेट विद ईच अदर, दे शुड talk to each other, discuss things, and this is how we can create a difference. Thank you.